So what's happening is we're having a changeover in our ratios of estrogen and progesterone because we're having more and more anovulatory cycles. So we're not releasing an egg. If we don't release an egg, then we don't produce progesterone. So we'll start having these imbalances between estrogen and progesterone. When we start having those imbalances between estrogen and progesterone, every system is affected because we have estrogen, progesterone receptor sites in every system. And when we look from a metabolic standpoint, we know that estrogen is really critical for stimulating the stem cell of muscle and myosin to create an integrity of the muscle, to create lean mass, to be able to build lean mass. Progesterone, on the other side, is responsible for clearing out a lot of extra carbohydrate and putting it into endometrial lining. It's also responsible for some of the power aspects of muscle, so the explosiveness of muscle. So when we start looking, when we have these changes, women will start noticing that their body comp is changing, or they might start feeling a little bit squishier, or they're not adapting as well as they used to, maybe even 2 years ago, maybe even a year ago. And when we get to that point, this is where we have to look for an external stress that's going to take the place of what those hormones used to do for us. So this is where we start looking at what kind of external stress can we give the muscle so that we get the signal to develop lean mass, maintain that neuro connection so that we can have a really strong contraction, so that we don't lose the power, so that we keep the signaling to build a lean mass and not put on body fat. We need to look at heavy resistance training. We have to look at plyometric work because these are very hard stressors to the body, and the body adapts to that in a different way because it doesn't have the hormones to help support that adaptation.